Hi everyone, today we will explain about liquid-based preparation cytology, principle and application. Without further ado, let's go. Liquid-based cytology, LBC, is an alternative way to conventional pap smear test. This monolayer slide preparation method has been proven to be more effective than traditional pap smears due to standardized cell transfer, enhanced fixation, and a reduction in obscuring factors. There are currently 3 liquid-based preparation techniques, but in this video, we will only talk about thin prep and sure path preparation techniques as they are commonly used in cytology laboratories in Malaysia. Now I will continue to explain the thin prep liquid-based cytology. Basically, the principle of thin prep LBC is based on dispersion of the cell and collection of cells on disposable polycarbonate filters by vacuum filtration, which are then transferred to glass slides using air pressure for attachment. Okay, now continue to the procedure of the thin prep technique. The first one is specimen collection. Insert the endocervical broom into the endocervical canal deep enough to allow the shorter bristles to fully contact the ectocervix, and rotate the broom in a clockwise direction 5 times. Be careful to not over-rotating the brush because it may cause excessive bleeding, which leading to an unsatisfactory pap test. After that, rinse the broom quickly into the methanol-based preservative solution by pushing the broom into the bottom of the vial 10 times. And then, swirl the broom vigorously to further release material. Discard the collection device. The preservative solution is a methanol-based reagent that serves as a transport, preservative, and antibacterial medium for gynecologic samples. Lastly, the thin prep sample vial is then capped, labeled, and sent to a laboratory. Second procedure is dispersion. This is the first principle of the thin prep technique. At the laboratory, uncap the vial and loaded it into the thin prep processor. After that, place the filter onto the filter cap, then load it into the processor just like the clip in the slide. Labeled slide is placed into the thin prep processor. Same goes to the fixative solution. The filter is then inserted into the vial. The cylinder rapidly rotates within the vial and disperses the cells, which will separate blood, mucus, and other debris. Third procedure is cell collection. This is the second principle of thin prep technique. When vacuum is applied to the cylinder, it will aspirate the cell suspension through the filter, which most of the broken red blood cells and debris are allowed to pass through while the cells trap on the filter. Next is cell transfer. This is the third principle of thin prep technique. After the cells are collected on the surface of the filter, the thin prep filter is inverted 180 degrees and gently pressed against the slides. The result is a 20 mm circular smear with even distribution of cells and minimal overlap. After that, the fixation process. This is the last principle of thin prep technique. The glass slide is automatically submerged into the 95% ethanol fixative. Fixation will help to prevent the cells from drying out and shrinking and maintain the cytological morphology. Lastly, the staining process. Papinicolau staining is either performed manually or in an automatic stainer. Next, I will continue with SurePath liquid-based cytology. So first things first, what is the principle of SurePath? The principle is based on density gradient sedimentation. During centrifugation, the components of a sample will be separated based on their density according to the centrifugal force they encounter. So I classified the procedure of the SurePath into 6 parts. The first part is the specimen collection. It is highly recommended to use a rover's cervex brush because the brushes are flat on one side and rounded on the other for gentle scraping. This can prevent any trauma in the cervix area. Next, for this brush, there is a detachable head. So what is the importance of a detachable head? Let's see. So after the specimen collection, the rover's cervex brush will dip into the vial that contains 24% ethanol. Next, the head of the sampling device is slipped off and the vial is capped off with the head of the device left in the container. Next, the procedure is vortexing. The machine that we will use is a vortex machine. The sample will be mechanically dispersed at 3,000 revolutions per minute for 30 seconds. What is the function of vortexing the sample? The function is to separate the cells from one another and any cell that is adhering to the collection tool. The next procedure is cell enrichment. The machine that we will use is a prepmate device. The specimen rack of the prepmate will be loaded with a plunger, the sample vial from earlier, and a centrifuge tube containing 4 milliliters of density reagent. The prepmate will mix and remove the specimen from the preservative vial and layer it onto the density reagent in the centrifuge tube. So, what is the importance of cell enrichment? Cell enrichment is important to separate and eliminate blood, mucus, and other interfering materials from the sample, leaving just the most diagnostically important material on the slide. What if we didn't do cell enrichment? As you can see from the picture, the slide will have clear regions that contain mucus, blood, and protein that will interfere with the diagnosis. The next procedure is centrifugation. The machine that we will use is a centrifuge. So, what is the importance of gradient centrifugation? Gradient centrifugation will remove small particles such as proteins, disrupted membranes, microbial artifacts, and red cell artifacts based on particle size. The sample will undergo 2 centrifuges, which are soft spin and hard spin. For the soft spin, the tube will undergo a soft spin for 2 minutes. Heavier diagnostic material is allowed to pass through the gradient and settle at the bottom of the sample, while lighter material remains trapped in the sample layer above. The supernatant will be removed before the hard spin. A hard spin will be done for 10 minutes to concentrate the diagnostic component into a cell pellet at the bottom of the tube. The supernatant will be removed and the pellet will be vortexed again before the resuspension process occurs. The next process is resuspension, and the machine that we will use is the prep stain machine. So let's watch the video for a better understanding. First things first, disposable settling chambers are attached to the slides. The diameter of the settling chamber is 13 millimeter. Then, the robotic arm will pick up the disposable tip and insert water into the tube to resuspend the cell pallet. The next process is sedimentation. 200 microliters of cell suspension will be transferred to each settling chamber. Then a 10-minute drying phase is given for the cell to settle onto the slide. Next, 600 microliters of alcohol is transferred to each settling chamber for washing and left for 60 seconds. For cell staining, as seen in the video, the stain bundle will move and dispense the staining reagents as appropriate. The pre-butane machine will produce a uniform layer of stained cells in a 13-diameter circle. Next, the comparison between LBC with conventional pap smear and thin prep with SurePath. The differences between LBC and pap smear can be classified into sample collections techniques, microscopic examination, screening time, cell cancer detection, and satisfactoriness of the specimen collected. As for thin prep and SurePath, the difference can be seen in sample collection techniques, technology, and sampling devices used for taking and producing the slide, size of the cell disc, and number of tests that can be done in 1 hour. Last but not least, here are some advantages and disadvantages for LBC. So these are our references. Thank you for listening and have a nice day.